Welcome to Health Champ, your source of a wide range of health tips and hacks. This video is intended for informational purposes only, and is not purposed to replace a consultation with a medical doctor. What is UTI? A urinary tract infection, or UTI, as commonly as referred to, is an infection in the body's urinary system that primarily involves the urethra. If left untreated, the infection can spread to the bladder, ureters, and the kidneys. While this affects both men and women, the latter are more susceptible to this infection due to the shorter urethra where bacteria can enter. What causes UTI? Fungi and E. coli can cause the infection of the urinary tract. While it can cause UTI, fungus is less likely to do so, and the more common bacterium found in urine cultures of UTI patients is E. coli. Because E. coli bacteria live in the gastrointestinal tract, it can get passed from the rectal and anus area. Especially among women, bacteria can be transferred from the surrounding surface of the anus and onto the genital area when wiping the private part. A second cause of UTI is poor hygiene. Bacteria thrive in our sweat, and most especially when skin surfaces are not clean and don't get to breathe much air. A third cause of UTI is sex. Primarily by intercourse and oral sex. Sexual intercourse risks UTI when the male genital is introduced to the entry of the female reproductive system, thereby the possibility of spreading bacteria directly inside. The mouth is also full of bacteria, and while these bacteria die with the acid of the stomach, they can survive and multiply inside the urinary tract. What are the symptoms of UTI? Patients with UTI find a need to urinate more often than they regularly do. Having to urinate once every 40 to 60 minutes may mean you have UTI. If you feel a stinging or burning sensation when urinating, it may mean your urinary tract is infected. If you experience pain in the lower abdomen, it may mean several other health conditions, but this is also one of the symptoms of UTI. There is usually a trace of blood in urine when a patient has UTI, but normally, this is not visible. When it is, you need to see a doctor immediately. If the infection gets worse, patients develop a fever. In most cases, doctors prescribe antibiotics. How to treat UTI at home naturally. It is necessary to consult your doctor for proper diagnosis and treatment. Doctors will usually prescribe antibiotics to treat the infection. There are pros and cons of using antibiotics, but there are people who would prefer to harness the power of the body and apply natural treatments. For uncomplicated cases of UTI, there are home remedies you can do to treat a urinary tract infection. Uncomplicated means, you don't have fever, there is no visible blood in your urine, you have no swollen parts in the abdomen area, you have not developed bacterial resistance to antibiotics, you have no heart problem or disease, and your immune system is not compromised. Here are 8 home remedies for treating UTI. 1. Drink no less than 2.5 liters of water. Bacteria need to be flushed out of your system, along with other impurities. The infection also needs to be cleansed. To effectively do this, you need lots of water so you can urinate more. The amount of water will vary from person to person, but 2.5 to 3 liters of water per day should do the trick for adults. Be advised though, that people with certain conditions, such as heart disease, may actually need fewer water intakes due to the water retention rate of their body. In such cases, consult your doctor. 2. A glass of cranberry juice. While different studies have shown different results, this is one among the several more natural and well-established treatments for UTI. Unless you have dietary restrictions for consuming cranberry juice, on a half-empty to empty stomach, drink a glass of cranberry juice. Studies have shown, and have proven, that cranberry has antibacterial and anti-inflammatory properties. Conducts of research have also shown that cranberry juice has properties that prevent E. coli from multiplying within the urinary tract system. 3. Don't hold it. The first 2 home remedies we have identified so far are about drinking fluids to flush the bacteria out and cleanse the infection. So, when you feel the urge to urinate, go immediately. Don't hold it. Remember, you're treating an infection, so, if you are, perhaps, in a meeting, just politely excuse yourself if you have to. If you hold it in, bacteria in the urine that's being flushed out may get enough time to reattach themselves to the urinary tract, and then multiply again. When you feel you need to urinate, even during sleep, get up and go immediately. 4. Use breathable 100% cotton underwear. Bacteria thrive in trapped moisture, and one of the ways to prevent UTI, and also a home remedy for when you have one, is to keep the breathability of female genital area. Make sure to use 100% cotton underwear that's cotton all over. With this kind of underwear, air circulates and prevents trapped moisture. 5. Wipe from front to back. As discussed earlier, especially for women, UTI commonly develops when bacteria from the anus gain access to the urethra and work its way up the urinary tract while multiplying. This happens when wiping the anus or the genital area. So to exercise care and prevent UTI, or to not complicate it further if you're already treating one, just wipe the genital area after urinating, from front to back only once. When wiping the anus, wipe from front to back, preventing it from coming into contact with the genitals. Be sure to exercise further hygiene by using separate pieces of toilet paper to wipe the genitals and anus. 6. Exercise sexual hygiene. Oral sex can transfer bacteria in the mouth to the genitals. We have already established earlier that the mouth contains plenty of bacteria that can survive and multiply inside the urinary tract. Sexual intercourse also introduces microbes to the urethra when the male genital penetrates the vagina. Here are things to practice before, during, and after sex. First, shower and wash the genitals before sex. This minimizes the bacteria that can transfer from person to person. Second, brush your teeth and rinse with distilled water. Third, take extra precautions when using condoms. Make sure to use separate condoms when engaging in oral, anal, and vaginal sex. Fourth, and this is important, urinate soon after having sex, preferably in the next 30 minutes. So, perhaps, you should drink at least a glass of water before having sex, so you can easily urinate right after. The process of micturition flushes out bacteria that are clinging to the urethra. Fifth, shower and wash private parts with mild soap or use feminine wash. Yes, even for men, feminine wash have the right pH level that's not harsh to the skin of the intimate parts of the body. Sixth, don't forget to brush your teeth again, and gargle with mouthwash. 7. Avoid swimming and bubble baths. While swimming pools are normally treated with chlorine, and this can kill bacteria, no one knows who violates the pool rules and regulations. In some studies, especially public pools, researchers found that it's relatively more urine than water and chlorine. Unless it's a private pool and you're sure of the water, better just avoid it. Avoid bubble baths too. Tap water may contain bacteria that can easily enter the urethra if you stay long enough immersed in the tub. 8. Take supplements. While there is no absolute proof that vitamin C can cure UTI, some studies show that when given the proper dosage, the combination of probiotics and vitamin C can treat UTI fast. We learned in science classes that not all bacteria are bad. Probiotics are good bacteria, which can help keep our body healthy and free from harmful bacteria. Bacteria from the genus Lactobacillus, in particular, are good bacteria that help with treating and preventing UTI. By preventing harmful bacteria from multiplying inside the urinary tract, infection can be prevented or treated. People who take probiotics, while also taking antibiotics, to treat urinary tract infection, develop less antibiotic resistance than people not taking supplemental probiotics. Consult your local pharmacy for probiotic options. You can also take vitamin C supplements, or get vitamin C from a healthy dose of fresh fruits, like kiwi, oranges, and strawberries. Tomato juice, pink grapefruit juice, cranberry juice, and broccoli are also natural sources of vitamin C. Studies show that vitamin C can kill bacteria when it forms nitrogen oxides after a reaction to chemical ions in the urine. In the same process, it lowers the pH level of the urine, making it less likely for bacteria to survive and multiply inside the urinary tract. Thanks for watching. If you learned something new, please hit the like button below. For more health tips, tap or click the subscribe button. While you're at it, ring the bell button to get notified when we post new videos.